Hello, my name is Bill Kowaleski, and this is Liquid Gold, the benefits of breastfeeding for mother and child. Breast milk is widely acknowledged as the most complete form of nutrition for infants with a range of benefits for infants' health, growth, immunity, and development. Why is breastfeeding so important? The nutrients and antibodies found in breast milk protect your baby. The direct effect of breastfeeding is directly connected with healthy growth, immunization against disease, and stable mental health. The decision to breastfeed is one that is very personal. There are many benefits of breastfeeding both for mother and the baby. Breastfeeding dates back to as early as the Egyptian, Greek, and Roman empires. Traditionally, women would only breastfeed their own children. When this became too common of a practice for royalty, wet nurses were hired to breastfeed the children of the royal families. This practice was used over the ages until about the 15th century. During this period, um, cow and goat's milk was attempted to replace the breast milk but was unsuccessful. In the 18th century, flour and cereal mixed with broth were attempted to replace breast milk. Again, however, these attempts failed. Western societies, particularly the US and Canada, started to view breastfeeding as uncultured and disgusting by the 1900s. Around the mid 19th century, there was a large boom in the introduction of infant formula. In the mid 19th century, however, in the 1960s, breastfeeding was viewed as a much healthier alternative to formula. This trend continues to this day, though there are some negative points of view on the topic still. There are a few methods of use for breastfeeding. Exclusive breastfeeding simply means that the mother is solely breastfeeding her own child. There's no wet nurses or shared breastfeeding taking place. Shared breastfeeding is when a wet nurse is hired to help the mother breastfeed the child in addition to taking place with the mother. This practice is not favorable these days. It still occurs mostly in mothers who have difficulty breastfeeding, however. The use of a breast pump has helped mothers dramatically in terms of those who have trouble breastfeeding and those who return to work right away. Um, a mother can pump her milk through the use of a breast pump and store it for immediate or, in most cases, later use. Typically, breast milk can be kept at room temperature for about 6 hours. It can be refrigerated for about 8 days and can be kept frozen for about 6 to 12 months. Many difficulties or restraints or even lack of knowledge come with breastfeeding. Of course, there are harmful effects to consider if you plan on breastfeeding a child. Um, a child should not be breastfed if the mother is HIV positive. The virus can be passed through the child to the child through the breast milk. If a mother is active tuberculosis, being treated for cancer, or receiving chemotherapy or using drugs such as cocaine or marijuana, it's not a good idea to be breastfeeding your child. A mother should not breastfeed if she's taking medications for migraines, arthritis, Parkinson's disease, and as always, uh, moms should consult their physician when attempting to breastfeed while on any prescription drugs. If a mother has the flu or a cold, it shouldn't deter you from breastfeeding your baby. The infant can't get sick through the passing of the milk through a flu or cold. It won't pass through the milk. However, antibodies may pass through while sick, and the baby will absorb these antibodies to help fight the illness. Women worry about the amount of breast milk they'll be able to produce and if their baby is getting enough milk. Um, Usually, when a baby produces about 6 to 8 diapers per day, they're getting enough milk. Staying hydrated, getting plenty of rest, following a well balanced nutrition plan all help and play a major role in producing enough milk for the mother and her baby. Sore, dry, cracked nipples are another setback a mother can experience during breastfeeding. Avoiding soaps and scented lotions and creams will help with healing between feedings. Also, icing down the nipples to help avoid swelling and discomfort between feedings. The child sucks the hardest the first few minutes of feeding, so minimizing discomfort is a must, to avoid as much pain as possible. Mastitis, which is when bacteria enters through the breast through the cracked nipple. Stress, premature babies, and block ducts all play a role in limiting a mother's ability to breastfeed. Early breast milk, colostrum, is referred to as liquid gold. Colostrum is the thick yellow first breast milk that you make during pregnancy as a woman and just after birth. This milk is very rich in nutrients, antibodies, and help protect your baby. Although your baby only gets a small amount of colostrum um, at each feeding, it matches the amount that your baby's stomach can hold. Between the third and fifth day after birth, colostrum changes into a thinner, more watered down version called mature milk. Though thinner than colostrum, it still contains all the nutrients and antibodies needed to fulfill the baby's needs. Breast milk is easier to digest for babies over formula. Formula has a lot of proteins from cow's milk, which take longer for the baby's body to break down and digest. Um, the chemical makeup in breast milk is far superior than that of formula. The cells, the hormones, the antibodies found in breast milk combine to form a unique protection against illness for babies. Breast milk is a nutritional source that cannot be replaced by any other type of food or formula. Though breast milk can contain pollutants, it remains far superior nutritionally to infant formula. It contains the exact amount of fat, sugars, water, and protein needed for a baby's growth and proper development. The quality or composition of a mother's breast milk changes. It does change after some time. As mentioned earlier, the colostrum changes into a thinner version called mature milk. The composition of the breast milk can also be changed depending on how long the child feeds, as well as a particular age of the child. Overall composition of a mother's breast milk can be altered negatively with the use of caffeinated drinks, alcohol, drugs, and smoking. The benefits of breastfeeding are beneficial physically, mentally, and fiscally. Both breastfeeding, though breastfeeding not only improves a child's overall health, but the mother's health also. The production and delivery of breast milk to a child is just as important as the nourishment it provides a child. Women who breastfeed for 2 or more years reduce the chances of developing breast cancer by 24%, which is pretty astonishing. Breastfeeding also reduces the risk of osteoporosis in a woman's later years. Women who breastfeed have been less likely to develop ovarian cancer, uterine cancer, and endometrial cancer. Oxytocin and prolactin are released during breastfeeding, which allow the mother to become more nurturing toward her baby. Oxytocin levels are increased during breastfeeding, which allow for a mother's uterus to contract and heal faster during labor. This helps with the bond the mother has. The bond that's created during breastfeeding between a mother and child is that of which can be undescribable. It's something that's sacred and pure. It can never be taken away. Researchers have said that the bond between a nursing mother and her child is stronger than any other human contact. Holding a child to the breast provides most mothers with a more powerful psychological experience than carrying the fetus in her own uterus. The relationship between the mother and child is rooted in the interaction of breastfeeding. This feeling sets the health and psychological foundation for years to come. Another major benefit of breastfeeding for mothers is losing weight that is gained during pregnancy. Of course, breastfeeding alone won't lose all the weight gained. A healthy diet and exercise are also recommended to help get back that before pregnancy body. The fat accumulated during pregnancy is used to produce milk. As the mother lactates, their bodies produce more milk. In turn, they produce more energy, resulting in burning more calories. Financially, the benefits include not spending a ton of money on formulas, nipples, and baby bottles. These items are necessary to have, just not as much. Also, breastfeeding a child reduces the child's need to be seen by doctors often and less frequent trips to the hospital, resulting in lower doctor bills. Overall, breastfeeding is a fiscally responsible decision. It seems that the benefits of breastfeeding for a child are endless, from immunities to mental health to reducing child obesity. The list goes on. The nutrients provided in breast milk can help fight off virus and bacteria. Breastfeeding has a direct effect on strengthening a child's immune system and helping to improve normal immune response to certain vaccines. The antibodies provided in breast milk help reduce the child's chances of having allergies or becoming asthmatic. Breastfeeding helps reduce the risk of the child obtaining diabetes, certain cancers, and SIDS which is sudden infant death syndrome. The nutrients and antibodies found in breast milk are a perfect mix to help the baby grow and develop properly. Mentally, breastfeeding has been linked to higher IQ scores later in life. Cognitive development is more increased. Children who are breastfed develop fewer psychological, behavioral, and learning problems. The more the child is breastfed, the less likely the child will develop depression, delinquent behavior, or attention issues. The general makeup and the unique composition of breast milk have a direct effect mentally on a child being fed. Several recent studies have shown that children who are breastfed show significantly less likely to become obese later in childhood. Formula feeding is linked to about 20 to 30% greater likelihood that the child will become obese. This seems to be the result of a parent's force feeding the child through bottle feeding, whereas breastfeeding the child naturally develops a self-regulation of the milk intake from the breast. The results couldn't be clearer. The direct benefits of breastfeeding for a mother and her child far outweigh those of formula and bottle feeding, whether they're mentally, physically, or financially. Though there are some traditionalists out there who think that this type of behavior is unacceptable, that should not deter a mother from depriving her baby of the benefits of this practice. It helps to improve the overall health and well-being of both the mother and the child. That was Liquid Gold, the benefits of breastfeeding for mother and child. My references are the NRDC.org 2010, the benefits of breastfeeding, WebMD.com 2010, breastfeeding overview, and womenshealth.gov 2010, why breastfeeding is important. These can all be looked up online, and I hope you enjoyed the presentation. Thank you.